Good afternoon. My name is Heidi Schwarzwald. I'm our Pediatric Chief Medical Officer for the Texas Children's Health Plan, and I'm so excited to talk to you today about the 2015-2016 cold and flu season for the state of Texas. We are here now in mid-November, right before Thanksgiving, and the good news is this year we have seen very little cold and flu so far here in Texas. In fact, according to the state flu surveillance website, there's very little activity that's confirmed to date. Some in central Texas, but very little here in the Harrison-Jefferson County area. What I think is the best part about this is that we still have plenty of time to get our patients their flu shot. So as patients are continuing to come into clinic, we want to really encourage every patient to get their flu shot. With this year's CDC recommendations, really every child over the age of 6 months should be receiving a flu shot, whether that's the intranasal or the actual immunization. So this year, as in years past, we have a choice of both the trivalent and the quadrivalent vaccines for our patients, whether the intranasal or the injectable. This year, the makeup of the vaccines has been altered a little bit from last year, and what we know so far from surveillance in other parts of the country will be very well matched to this year's flu season. So of course we have the 2009 H1N1, which has remained predominant throughout the United States since then in our flu epidemic. We also have the H3N2 this year, and that seems to be what we have seen, again in very small numbers, but have seen some confirmed cases. And then 2 different influenza subtype Bs if you're giving the quadrivalent, or 1 subtype B if you're giving the trivalent. A slight difference this year in the recommendations is really any child under the age of 8, we are now recommending gets 2 vaccines a month apart if it's their first season to receive the flu vaccine. So that has changed a little bit from last year. But again, really any patient over the age of 6 months should be getting the vaccine. Of course, if you're seeing babies less than 6 months, we want to encourage their caregivers to get the vaccine to protect the infant themselves. That's what we call cocooning, and can be very successful. And while as pediatricians we may not be treating them, we never want to forget about the pregnant moms, whether we're seeing her first or second child and this is her second or third child, or whether we're seeing her for a prenatal visit. We really want to make sure that she, and even better, her partner, are getting their vaccines to really protect that infant as well as the other children in the household. Prevention is the key with flu, and so in addition to getting your flu vaccine, we want to teach our patients and our families, as well as our staff and other providers in our offices, about the basics. Good hand hygiene, washing your hands, using hand sanitizer. These very simple steps are what really protect us the most. Teaching our children to wash their hands, teaching them to sneeze into their elbow instead of into their hand. These are the things that will protect them. If we want to help protect our community, of course, as hard as it is, letting our children stay home when they are sick so they're not spreading disease to others is a good advice to our patients and families, as well as to ourselves and our staff, to try and stay home when we're sick so we're not spreading it to patients. And of course, we don't just want our patients and their parents and their caregivers to get the vaccine. We need to get the vaccine ourselves as the pediatricians and as the advanced practice providers and other healthcare professionals, including our staff. So encouraging our nurses and medical assistants to get their vaccine will protect them, protect their families, and of course protect our patients as well. One other thing we can do to prevent getting sick just in general, of course, is getting enough sleep. So we always want to make sure that us and our families and our patients are getting enough sleep, as hard as that is. That keeps our immune system strong and allows us to fight off diseases. Often you'll hear talk about treatment once you do have a confirmed case of the flu. How helpful is Tamiflu or some of the other antiviral medications? So in a normal, healthy patient or child, Tamiflu will really only reduce their symptoms for about half a day. In addition, it can increase by almost 10% their nausea and vomiting. So I think we need to be careful when counseling families on the utility of using the antiviral medications. Certainly if dealing with a child with a complex medical history, with asthma, with other medical complexities, Tamiflu becomes much more relevant. Again, in your normal healthy child, it will reduce their symptoms by half a day, but doesn't necessarily reduce their risk of hospitalization with flu. We know last year, unfortunately, there were still 140 deaths of children to flu. And so as a disease that is incredibly preventable, we want to do everything we can to prevent these diseases. If you're interested in tracking flu and when flu is going to be coming to Texas, you can certainly go to the CDC website, www.cdc.gov, or of course in Texas, it's the Department of Health and Human Services website. If you put into your search engine just 2015-2016 Texas flu surveillance, it will take you right to the site. It's been my pleasure speaking with you today. I hope to speak to you more on other topics in the future, and do have a safe and good holiday and